Thank you for joining us today on Devils in the Details. I am Annie DeGraw, and today joining us, we have Dr. Josh LeBaire from the ASU Biodesign Institute. COVID-19, not something that was in our vernacular a year ago. Now, pretty much the only thing we can talk about. This is the third ASU semester where COVID-19 has greatly impacted what we're doing as a university. Can you talk to me? But there are some, I think, hope on the horizon, the vaccine being one of the biggest projects that is being worked on right now. Dr. LeBaire, can you talk to me a little bit about how things have changed over the last 12 months and what there really is to look forward to?
Right. Well, yeah, no, I mean, as we speak right now, Arizona is in a huge surge of COVID-19. It's worst ever, huge numbers of new cases every day, and our hospitals are filled with COVID-19 patients. So in terms of the immediate moment, things are a little rough. But you're right, there is hope on the horizon. We have two outstanding vaccines that are available. Both of them have a success rate in the 95% range. Both prevent severe illness. And I think if we can use those and get everyone to take vaccines, we really can look forward to getting back to a degree of normalcy that I think we're all looking forward to.
I'm sure you are very much like me, being part of the medical community, but you see it even more. When I have friends and loved ones post a video with their first vaccine photo, it is such a rush of elation because it really does feel like the light at the end of the tunnel. And ASU actually, faculty is going to be a part of this 1B rollout. Can you tell us who falls into that 1B rollout? And also just talk to us, how does the average person know when it's their turn for a vaccine?
Right. Well, yeah. So first, I will echo what you said. Because I run a clinical testing lab and because I am exposed to live samples, I was in the 1A group, and I can't tell you how wonderful it felt to get that shot. Of course, the arm is sore, but the notion that I will be protected is just huge for me. 1B is what we're currently up to now, and that really focuses on two key groups: essential personnel, people who are necessary for keeping the community running, and among those are educators, and in that sense, members of the ASU group that include people who are professors or educators, instructors, people who teach students. We definitely want them vaccinated because they interact with many students at a time, and that education is critical for society. So they're among that group. In addition, 1B includes people over 75. And that's a really important group to get because, as we mentioned earlier, the hospitals are filled right now with patients in the ICUs and in the hospital beds with severe COVID-19. And typically, many of those individuals are older, and the over 75 group run a very high risk of having bad outcomes. The 1B group is not going to impact the spread of illness statistically in our community at all. The numbers are too small. But what it will do is it may reduce the burden to our hospitals. If we can vaccinate these older folks who have a high risk of ending up in the hospital and keep them out of the hospitals, then people who have other medical conditions that need to be seen in hospitals will have access again. Right now they don't, and that's why it's so important.
You are always so good about breaking this extremely confusing subject down. There's so many questions about vaccination. Who gets them, when, what is the greatest benefit? You brought up the 1B, individuals over the age of 75. There's been discussion from mathematicians, I know, does it make sense to actually vaccinate our younger population who could be the spreaders? Who is in charge of getting this vaccination out, particularly in our own valley, but also what is sort of the science behind who gets it and when?
Right. Well, so first of all, it should be mentioned that right now, the decisions about vaccination are made at the state level initially. So the vaccine comes to the Arizona Department of Health Services. And in Arizona, they have decided to hand that off to the counties. So here in Maricopa County, it's the county that determines who gets vaccinated. Now, the state has also opened up some vaccination itself. The way that they're rolling out the vaccination is basically developed based on some recommendations made by the National Academy of Sciences, which looked at everything and thought that there are a couple of groups that needed to get early vaccination. Those included healthcare workers, because if we lose our healthcare system, we're all in deep trouble.
Absolutely.
And so especially people like frontline workers who work with patients are getting vaccinated. But then they were looking at this priority that I mentioned a little bit earlier, this notion that we need to keep our hospitals open. People, who have chest pain, people who have had discovered a lump, people who have other illnesses or other infections or, whatever, they need to get care. And if the hospitals are overwhelmed, as they are at the moment with COVID-19 patients, they won't get that access. There's a difficult calculus that some people have to make right now. If you got chest pain right now and you're an elderly person, and you know that the comorbidity of having heart disease with COVID-19 is one of the biggest risk factors for bad outcomes, do you go to the hospital? You need your chest pain taken care of, but the last thing you need right now is to acquire a case of COVID-19. And so for that reason, we need to, vaccinate those people who are most likely to end up in the hospital to keep them out of the hospital so that we can free up the healthcare system.
That's a very simple way of putting it. And I think the next question on most people's mind is, at what point are enough vaccinations out in the community at large where we have some type of herd immunity, some type of safety to this virus?
Right, that's a really important point. So first of all, we need to recognize that right now that we're not there yet. The number of people getting vaccinated is still quite small and has really no impact on spread in the community. And that means that all of us need to continue wearing masks. We need to continue maintaining spacing. We need to follow all the factors that we know reduce the spread in the community, because really we're not going to see any impact on spread until we get to about half the population vaccinated. And still the possibility for epidemic could occur there. To prevent the spread in an epidemic fashion, we need to get between 70 and 80% of the population resistant to virus. And then we acquire what we call herd immunity. Important to remember, we have had herd immunity before. For example, for measles, we have herd immunity. That does not mean that nobody gets measles. Measles still exists in our community, and we can still get outbreaks in communities when they start to drop below that 75, 80% rate. So even when we reach herd immunity with COVID-19, we will not be, that doesn't mean that we won't still have the virus around, but it does mean that we won't get this rampant spread, this exponential spread. And that's really crucial right now, because that's what's really holding us all back.
And you brought up such an important point. Get the vaccination, of course, but we have to continue those same measures: social distancing, wearing a mask, and making sure that we're taking care of those individuals who are at a higher risk. So I have gone down the rabbit hole on vaccinations because it's what we're all sort of looking to in the future. But testing, still extremely important. Is ASU going to continue the saliva testing that they've become known for over the last few months?
Yes, we're very aggressively continuing our saliva testing. In fact, if anything, we're doubling down and trying to increase testing. Testing is key for a lot of reasons. Probably the most important is that this virus spreads from people who don't know they're sick. Probably 60% or so of all infections come from people who are either pre-symptomatic or asymptomatic. So people are spreading virus and they don't even know they have it. And that's why we have to kind of routinely maintain spacing when we don't even know we're sick, because we might still have virus. But testing is our way of finding those people who have virus. And so I am always reminding people that if they work in jobs or if they have a routine that gets them out into the public where they interact with people that are not in their own immediate family, if they're repair people, if they're salespeople, if they work in stores, if they work in clinics, anyone like that ought to get tested regularly. And we have free public testing. So just go to one of those free public sites, get tested on a routine basis. And if it finds you're positive, then at least and you can stop spreading the virus that way. So we found that the testing itself reduces the virus in the community, and that's why it's so important to do.
And taking away that stigma around testing, get tested regularly. It's so important because you need to know your status. Some of the people that have the most interaction with our community right now, particularly as we head into the spring semester, K-12 teachers. Can you tell me, what is ASU doing to help this community particularly right now?
Right. Well, we're very pleased that we've built a partnership with the Arizona Department of Health Services, and they are underwriting testing of our K through 12 teachers and their population. So we are now already rolling that out. We're doing it step by step. So got a pilot group of schools that we're working with immediately, but the goal is to expand that to all K through 12 teachers. And we're encouraging the teachers to get tested once a week. Teachers interact with many students. And even though we know that our K through 12 schools are not really a major source of spread in the community, it's turned out that in general, the schools, because they're a structured environment, are relatively safe. But still, there have been some moments where that has happened, some spread within the schools. And if we can get the teachers tested, we can keep them safe and keep the schools open, which we all want to see happen.
Absolutely. Last question for you, Dr. LeBaire, and this is really your opportunity, I think, to sort of make a plea. Lots of questions still remain about the vaccine, but if you had to talk to someone, why is it important that when their turn comes, they get the vaccine?
Right. Well, the vaccine is really our opportunity to get back to life as we once knew it. If we can get the population so that everyone is resistant to virus and so it can't take off as an epidemic anymore, we really can get back to normal. In fact, if we really got a highly successful turnout for a vaccine, there is even an opportunity to eradicate this thing. So, that's the kind of thing that we could look forward to if we can convince people the importance of vaccination. So I've had my vaccine. I can tell you it is not bad at all. My arm was a little sore. Other than that, it's really mild. It is nothing compared to what the virus can do to people. And the vaccine is quite safe. I mean, vaccines in general are quite safe. The major risk is, of course, allergic reaction, and we need to be aware that some people have those, but those are rare. Other than that, minimal risk and huge benefit.
Thank you so much for joining us today, Dr. LeBaire. Your talent over the last few months has just been a wonder to watch. And thank you, everyone, for joining us on Devils in the Details. I know we're all waiting anxiously for our vaccine. We need to continue to social distance and wear our masks. And please be safe.
Yep. Be safe, everyone. Thanks so much.